Welcome everyone to a journey through the world of contraception, where we'll explore the diverse methods and choices available. My name is Princess Irene Serrano, and I'll be the one to empower individuals to make informed decisions about their reproductive health. So, guys, do you have any idea about contraception? So, first, let's identify what is contraception. Contraception, often referred to as birth control, is the use of various methods or techniques to prevent pregnancy. The primary goal of contraception is to deliberately and effectively control the timing and frequency of pregnancy. These methods can include physical barriers such as condoms, hormonal methods like birth control pills or injections, intrauterine devices IUDs, sterilization procedures, tubal ligation or vasectomy, and fertility awareness methods. So we have two methods of contraception, which is natural and artificial. So first, let's discuss the natural. So what is natural method? So natural method defined as the natural family planning methods that do not involve any chemical or foreign body introductions into the human body. People who are very conscious of their religious beliefs are more inclined to use the natural way of birth control, and others follow such natural methods because they are more cost effective. So first, we have here the abstinence. This natural method involves refraining from sexual intercourse and is the most effective natural birth control method, with ideally 0% flow. It is considered the most effective way to avoid STIs, sexual transmitted infections. However, most people find it difficult to comply with abstinence, so only a few use this method. So, what is abstinence? It is refraining from sexual intercourse. They use only the outer course. So, outer course is a term that can be used to encompass a wide variety of sexual behaviors. It is often used to describe flirtage, tribalism, or other types of sexual body rubbing that do not involve penetration. It can also include kissing, ritual masturbation, talking about sexual fantasies, and similar activities. So next, we have here the calendar method. This method is also called as the rhythm method. It initially withholding from coitus during the days that the woman is fertile. According to the menstrual cycle, the woman is likely to conceive 3 or 4 days before the 3 or 4 days after ovulation. The woman needs to record her menstrual cycle for 6 months in order to calculate the woman's safe days to prevent conception. So we have here the menstrual cycle. To track your menstrual cycle, begin by keeping a record of your menstrual cycles for several months. Note the start and end days of each period. Determine the fertile window in a typical 28-day menstrual cycle. Ovulation, the release of an egg from the ovary, generally occurs around day 14. To estimate your fertile window, you can subtract 18 days from the length of your shortest menstrual cycle. This gives you the first potential fertile day. Then subtract 11 days from the length of your longest menstrual cycle to find the last potentially fertile day. For example, if your shortest cycle is 26 days and your longest is 32 days, your fertile window would be from day 8 to day 21 of your cycle. So, avoid unprotected sex during the fertile window if you want to prevent pregnancy. It's crucial to avoid having unprotected sex during your estimated fertile days. Use alternative contraceptive methods like condoms or abstain from intercourse during this time. Use a calendar to track. Mark your calendar with your estimated fertile days each month to help you plan accordingly. Regularly update your calendar. Continue tracking your menstrual cycles and updating your calendar as you go along. This will help you refine your understanding of your fertile days, especially if your cycles vary in length. It is important to note that the calendar method is less reliable than some other contraceptives methods and may not be suitable for individuals with irregular menstrual cycles. Many factors, including stress, illness, and lifestyle changes, can affect the accuracy of this method. If avoiding pregnancy is crucial, you should consider more effective contraceptive options such as hormonal birth control or intrauterine devices (IUDs). Additionally, including with a healthcare professional or fertility awareness educator can provide more guidance and accuracy when using this method. The third one is the basal body temperature or BBT method. Is a natural family planning technique used to track a woman's fertility by monitoring her daily body temperature. Here's a brief overview of how to use the BBT method effectively. First is purchase a basal thermometer, which is more sensitive and accurate than a regular thermometer. Then take your temperature daily. Take your temperature every morning at the same time, before getting out of bed, and after at least 3 to 5 hours of continuous sleep. Make sure to use the same thermometer consistently. Then chart your temperature. Record your daily temperature or a special BBT chart or a fertility tracking app, including the date and time. Then observe the pattern. Over time, you'll notice a pattern in your temperature chart. In the first half of your menstrual cycle, follicular phase, temperature are typically lower. After ovulation, they rise due to the hormone progesterone. The sustained rise in temperature indicates that ovulation has occurred. Identifying fertile window. Your fertile window is the days leading up to and including the day of ovulation. To avoid pregnancy, you should avoid unprotected intercourse during this time. Learning about your cycle, continuously track your BBT over several menstrual cycles to better understand your unique cycle and fertile days. Remember that the BBT method requires consistency and accuracy, and it's more effective when combined with other fertility awareness methods, such as tracking cervical mucus changes and monitoring cervical positions. It's also important to note that the BBT method doesn't predict future fertile days, but can only confirm ovulation after it has occurred. If you're using this method for contraception or family planning, is it advisable to seek guidance from a healthcare professional or fertility educator to maximize its effectiveness? So the fourth one is the cervical mucus method. Cervical mucus monitoring is a natural family planning method that involves observing changes in the consistency and appearance of cervical mucus or track fertility. So what is cervical mucus? So cervical mucus is a fluid produced by the cervix, the lower part of the uterus, and it plays a significant role in woman's reproductive system. The characteristics of cervical mucus change throughout the menstrual cycle under the influence of hormones, particularly estrogen and progesterone. So first, you should wash your hands. Begin by washing your hands thoroughly to ensure they are clean before checking your cervical mucus. Then select a comfortable position. Choose a comfortable position such as sitting on the toilet or squatting, where you can easily access your vaginal area. Check your cervical mucus. Insert a clean finger into your vagina to reach the cervix. Gently swipe the opening of the cervix or the vaginal opening to collect a sample of cervical mucus. Then observe a record. Examine the mucus you collect between your fingers. Note its color, texture, and consistency. Cervical mucus changes throughout your menstrual cycle. During your menstrual period, mucus is typically absent or minimal, and it may appear as blood thin. Then after menstruation, mucus may be sticky or creamy. Leading up to ovulation, mucus becomes clear, stretchy, and resembles egg whites. This is considered fertile cervical mucus. After ovulation, mucus return to a thicker, stickier consistency. Then record your observation. Keep a record of your cervical mucus observation on a chart or in a fertility tracking app. Note the date and type of mucus you observe. The presence of clear, stretchy cervical mucus indicates your fertile window and suggests that ovulation is approaching or has occurred. If you're trying to conceive, consider having intercourse during your fertile window to maximize your chances of pregnancy. If you're using cervical mucus monitoring for contraception, avoid unprotected intercourse during your fertile days. Learn more about cervical mucus changes throughout your cycle. To become proficient at interpreting the patterns accurately, cervical mucus monitor can be an effective method for tracking fertility, but it requires careful observation and consistent recording. It's important to note that this method may not be as precise as other fertility awareness methods, so it's often used in conjunctions and additional methods like basal body temperature charting or ovulation predictor kits for more accuracy. If you have questions or concerns about cervical mucus monitoring, consider consulting with a healthcare provider or fertility educator for guidance. The fourth one is the sempithermal method. It's a natural family planning technique that combines monitoring various fertility signs to determine the fertile and non-fertile phases of woman's menstrual cycle. So first is the tracking of basal body temperature or BBT. You can use a basal thermometer, as what I've said, to measure your temperature every morning before getting out of bed. Record the temperature in a chart or a fertility tracking app. The fourth one is the use of monitor of cervical mucus. So pay attention to the changes in your cervical mucus. Around ovulation, cervical mucus becomes clear, slippery, and stretchy, resembling egg whites. Record these changes daily. And the third one is checking of your cervical position. So get familiar with the position and feel of your cervix. It can change in terms of height, openness, and texture during your cycle. Record these changes if you're comfortable doing so. And the fourth one is chart your menstrual cycle. Use a chart or app to record your daily BBT, cervical mucus, and cervical position observation. Note the dates and any other relevant details. Over time, you'll notice patterns in your fertility signs. When your BBT rises and you observe fertile cervical mucus, it indicates ovulation can likely occur. This is your fertile window. To avoid pregnancy, abstain from unprotected intercourse during your fertile window. If you're trying to conceive, it is the optimal time for intercourse. So, properly learn the sempithermal method and consider seeking guidance from a healthcare professional or fertility awareness educator to ensure you're using it correctly. It's a highly effective natural family planning technique when used correctly, but it may not be suitable for everyone. If you're considering use this method for contraception or family planning, consult with a healthcare professional for guidance and to maximize its effectiveness. So another one we have here, the ovulation detection. Here is a brief overview of how to use ovulation detection methods. So first is ovulation production kits. Purchase an ovulation protector kit OPK from a pharmacy or online. Begin testing a few days before you expect to ovulate, based on your typical cycle length, often around mid-cycle. Follow the kit's instruction to collect a urine sample or use a test strip. The kit will detect a surge in luteinizing hormone LH that typically occurs 12 to 36 hours before ovulation. When the test indicates a positive result, it suggests ovulation is imminent. Lastly is the coitus interruptus. Coitus interruptus is one of the oldest methods that prevents conception. A couple still goes on it with coitus, but the man withdraws the moment he ejaculates to emit the spermatozoa outside of the female reproductive organ. A disadvantage of this method is the pre-ejaculation fluid that contains a few spermatozoa that may cause fertilization. Coitus interruptus, commonly known as the pull-out method or withdrawal method, is a contraceptive technique in which a man withdraws his penis from the vagina just before ejaculation during sexual intercourse. The idea is to prevent sperm from entering the vagina and fertilizing an egg. However, it is considered one of the least effective methods of contraception because it relies on perfect timing and self-control, and it offers no protection against sexually transmitted infections, STIs. It is less reliable than other forms of birth control such as condoms or hormonal methods, and should not be relied upon as a primary method of contraception. The second method of contraception is artificial methods. Artificial contraception refers to the conscious prevention of impregnation or conception by using different drugs, devices, or other scientific techniques. It is also known as a birth control or a fertility control method. So artificial methods of contraception, also known as birth control methods, are a technique or devices used to prevent pregnancy by internationally controlling the timing and accuracy of conception. The first method of artificial is oral contraception. So, it is important for individuals considering oral contraception to consult with a healthcare professional to determine the most suitable type of birth control pill and to understand potential side effects and health conditions. Consistent and correct use is crucial to maximize their effectiveness in preventing pregnancy. The second one is the transdermal patches are known for providing a consistent and continuous release of medication, which can lead to more suitable therapeutic effects and potentially fewer side effects compared to oral medications. The third one of artificial method of contraception is a vaginal ring. A vaginal ring is a flexible, often silicone-based device inserted into the vagina to release hormones for birth control or to treat certain medical conditions. It typically remains in place for several weeks and provides a continuous low dose of hormones to prevent pregnancy or manage specific health issues. Users replace it on demand or 3-monthly basis, depending on the product. Vaginal rings are an alternative to daily birth control pills and offer convenient. Using a vaginal ring effectively involves following. First is to start by talking to a healthcare provider to determine if a vaginal ring is the right birth control method for you. They will provide a prescription and guide you on proper usage. Then insert the vaginal ring on the first day of your menstrual cycle or as directed by your healthcare provider. This timing ensures immediate protections against pregnancy. Wash your hands. Before insertion or removal, thoroughly wash your hands to maintain cleanliness. While in a comfortable position such as squatting or lying down, squeeze the ring before your thumb and index finger and insert it deep into your vagina. The exact placement may vary depending on the specific product, so follow the manufacturer's instructions. The vaginal ring typically remains in the vagina for 3 weeks or 21 days. During this time, it continuously releases hormones. After 3 weeks, remove the ring by hooking your finger using it and gently pulling it out. This should be done on the same day. Will create a consistent schedule. Leave the ring out for 1 week. After the 1 week break, insert a new ring to begin the next cycle. Repeat this process until you decide to discontinue or switch to another birth control method. Occasionally, this to ensure the ring is correctly positioned. If it comes out accidentally and stays out for more than 3 hours or as specific by the product's instructions, you may need backup contraception. Communication with your healthcare provider. Keep regular appointments with your healthcare provider to monitor your health and discuss any concern or side effects. Backup contraception. If you are using the vaginal ring for the first time, consider using a backup contraceptive method, example condoms, for the first 7 days of use. Enhance effectively. Remember, the effectiveness of the vaginal ring relies on the consistent and correct usage, so it's crucial to follow the instructions provided with a specific product and consult your healthcare provider for your guidance. The fourth one is the subdermal implants. Implants are a long-acting contraceptive method that can provide protection against pregnancy for several years. Depending on the specific product used, they work by releasing hormones slowly into your bloodstream. It's important to consult your healthcare provider for personalized guidance on subdermal implant use and to address any questions or concerns you may have. So you can begin by discussing your birth control options with a healthcare provider. If you decide on a subdermal implant, they will provide a prescription and guide you through the process. Typically, subdermal implants are placed in the non-dominal arm. Your healthcare provider will help you select the best path for insertion. On the day of insertion, your healthcare provider will numb the area with a local anesthesia to minimize discomfort. The healthcare provider will insert the tiny implant about the size of a matchstick, just under the skin of your chosen arm. The procedure is relatively quick and usually painless. Your healthcare provider will confirm that the implant is correctly placed by feeling for it under your skin. The fifth one is the hormonal injections. Hormonal injections are highly effective when administered correctly and on schedule. They work by releasing hormones on your bloodstream to prevent ovulation and thicken cervical mucus, making it difficult for sperm to reach an egg. So the sixth one is the intrauterine device or IUDs. Are highly effective and long-lasting contraceptive methods. Hormonal IUDs work by releasing hormones locally in the uterus, while copper IUDs create an environment that is inhospitable to sperm. It's essential to follow your healthcare provider's guidance for IUD use and attend regular checkups to ensure its continued effectiveness and address any concern. The seventh is the chemical barrier of contraception. such as spermicides, are used to prevent pregnancy by creating a barrier that immobilizes or kills sperm. Here how to use them effectively. This is like a spermicidal product which can come in various forms, including creams, gels, foams. Follow the product's instructions regarding when to use it. Some spermicides require insertion before sexual activity, while others can be applied shortly before or up to an hour before intercourse. Another one is the diaphragms. Diaphragm provides a barrier to prevent sperm from reaching the cervix, and when using correctly and consistently, they can be effective method for contraception. It's essential to follow your healthcare provider's guidance and use the diaphragm as directed to maximize its effectiveness. So start by consulting a healthcare provider to get fitted for a diaphragm and receive proper instructions. The diaphragm comes in different sizes. While in a comfortable position, insert the diaphragm deep in the vagina, making sure it covers the cervix. In a comfortable position, insert the diaphragm deep into the vagina, making sure it covers the cervix. You may use your finger or an applicator for insertion. Ensure the diaphragm is correctly positioned and covers the cervix, forming a barrier to prevent sperm from entering the uterus. Insert the diaphragm before sexual intercourse and leave it in a place for at least 6 hours afterward. Do not remove it immediately after intercourse. If you have intercourse again within the 6 hours period, additional spermicide may be needed. Follow the product's instructions for reapplication. After the waiting period, gently remove the diaphragm by hooking your finger around the rim and pulling it out. Wash the diaphragm with mild soap and water after each use. So guys, we also have here the male condom, which is the most popular of contraception. The male condom is a latex or synthetic rubber sheet that is placed on the erect male reproductive organ before penetration into the female reproductive organ or trap the sperm during ejaculations. It can prevent STIs, sexual transmitted infections, and can be bought over the counter. Male condoms have an ideal fail rate of 2% and a typically fail rate of 15% due to a break in the sheet's integrity or spilling of semen. Using a condom is a simple and effective way to prevent unwanted pregnancy and protect against sexual transmitted infections. So first, you must check the expiration date. Ensure the condom is not expired. Expired condoms may not be as effective. So first check the expiration date. Ensure the condom is not expired. Expired condom may not be as effective. Open the condom packet carefully using your fingers, not teeth or scissors. Avoid damaging the condom. Remember to use a new condom for each sexual encounter and do not reuse condoms. Using condoms consistently and correctly is crucial for their effectiveness in preventing both pregnancy and STIs. Another is female condoms. Certainly, the female condom is a better method of contraception and STI prevention that's worn entirely by the female partner. Here's a brief explanation of how to use it. First is check the expiration date. Then ensure the female condom is not expired, as an expired condom may be less effectively. The female partner can find a comfortable position, such as squatting, standing with one foot on the chair, or lying down. Squeeze the smaller, closed end of the condom and insert it deep in the vagina. Engage in sexual activity as usual. The female condom provides a barrier to prevent pregnancy and STIs. After intercourse, gently twist and pull out the female condom. Be careful not to spill any fluid. Tie a knot in the open end of the condom to prevent any spillage. Do not flush it down to the toilet. Female condom can be used with both oil and water-based lubricants to enhance comfort. It offers protection similar to the female condom and can be an optional for those who prefer it for situations where the male partner is reluctant to use a condom. Another is surgical methods for contraception are permanently or long-lasting options for individuals or couples who do not wish to have more children. Here's a brief explanation of two common surgical methods. First is the tubal ligation for females. Tubal ligation, often referred to as getting your tubes tied, is a surgical procedure for females. During this procedure, a surgeon seals cut or block the fallopian tubes. This prevents eggs from traveling from the ovaries to the uterus, effectively preventing pregnancy. It is considered a permanently method of contraception and is not easily reversible. Second is the vasectomy for males. Vasectomy is a surgical procedure for males that involves cutting or blocking the vas deferens, the tube that carries sperm from the testes to the urethra. This prevents sperm from being ejaculated during sexual intercourse, although ejaculation still occurs without sperm. Vasectomies are generally considered permanent, but they can sometimes be reversed through a more complicated procedure. Both of these surgical methods are highly effective at preventing pregnancy, but should be considered permanent decisions. Reversal procedures are not always successful, so individuals or couples consider these methods should be carefully discuss their options with our healthcare provider to fully understand the implication of these surgeries. So this is the advantage and disadvantage of natural method. The advantage are no side effects, cost-effective, non-invasive, cultural and religious acceptance, and no hormonal changes. For disadvantage is less reliable, require discipline, not suitable for a regular cycle, risk of human error, and especially limited protection. So it is important for individuals or couples considering natural methods to be well informed, receive proper training or guidance, and be diligent in their use to maximize effectiveness while understanding their limitation. Consulting with a healthcare provider can help you choosing the most suitable method based on individual circumstances and preferences. The advantage and disadvantage for artificial methods. For advantage, it is highly effective, it is convenient, immediate reversal, STI protection, regular menstrual cycle. For disadvantage, it gives side effects, cost, medical consultations required, not suitable for everyone, and lack of spontaneity. These advantages and disadvantages of contraception method is not in the book, but I added it for you to be able to be more informed. And how many percent effective is contraceptive? The effectiveness of contraceptives can vary significantly depending on the type of contraceptive used. Here are some general ranges of contraception effectiveness. So first is the highly effective contraceptives, which is long-acting reversible contraceptives like IUDs and implants, over 99% effective. Sterilization, surgical procedure, tubal ligation or vasectomy, over 99% effective. The second is the moderately effective contraceptives
like birth control pills, typically 91% to 99% effective with perfect use, but maybe lower with typical use. Contraceptive patch and vaginal ring, similar effective to birth control pills. Injectable birth control, Depo-Provera, around 94% effective with the typical use. And lastly is the less effective contraceptives, which is the male condoms, about 85% effective with typical use. Then female condoms, approximately 79% effective with typical use. Diaphragms and cervical cups, around 71% to 88% effective with typical use. Then spermicides, various but typically less effective than other methods. So it is important to note that the effectiveness of any contraceptive method can vary based on individual factors such as consistent and correct use, healthcare conditions, and medical interactions to choose the most suitable method. Individuals and couples should consult with a healthcare provider who can provide personalized guidance based on their needs and preferences. Family planning through effective contraception is the cornerstone of responsible parenthood, allowing individuals and couples the freedom to shape their futures and build strong, thriving families. Thank you everyone for listening. I hope it makes sense because learning different contraceptive methods is very important in our lives. That's all and goodbye for now.